And we're recording.
All right, well, welcome everybody to this session of Hatched this morning. My name is Jenny Lamberts. I was a member of the Innovation Advisory Team this past year, and I'm glad to be hosting this session that will be presented by Lisa Meny and Callie VanLangen, who are both faculty in the College of Pharmacy. Just to let everyone know, this session is being recorded for future use, so please keep that in mind. And I will monitor our time today. This is a 30-minute session, so I'll give kind of a heads up as we get close to that 20-minute mark to leave time for questions. And with that, it's my pleasure to introduce Doctors Lisa Meny and Callie VanLangen, who will be presenting their session on transitioning in-person skills-based assessment to a virtual environment.
Thanks, Jenny. For those of you who don't know me, I'm Lisa Meny, and I'm going to kind of kick us off today. And to be mindful of our time, I'm going to dive right in. I see some familiar faces here on the call that actually helped us with this work as well. So that's exciting. And thanks, David and Lisa, for coming as well. Really, our objectives for this talk this morning is to describe the faculty and student perceptions of a virtual skills-based assessment. So again, just for those of you who maybe aren't as familiar, in the College of Pharmacy, we really, when we think of student assessment, we've kind of got that traditional exam-based classroom assessment, but then we also have a very large component that is really skills-based. So what are the skills, activities, and things that pharmacists need to be able to do? And so we're going to talk about that side of assessment today and describe some of the lessons that we've learned when we had to transition due to COVID-19 from doing those all in person to doing them in a virtual format. So I think all of us are pretty familiar with the problems that we faced last spring and maybe still this spring, depending of really that need to pivot very quickly from what we plan to do in person in our courses to doing that virtual. And, you know, for us in pharmacy, we really didn't feel like we had an option to just say, oh, that's okay, let's just do something different, because it is critically important that we assess our students' ability to perform some of those skills. And so we took a stab at doing it virtually. So just a couple of facts for you to know. We really focused on student communication. So, you know, we were talking earlier this morning about assessment in general. So it is important that whenever we're designing these, we know specifically what we're doing. And so this was really focused on communication. And historically, we were able to use standardized patients. So we would have volunteers from the community that actually Callie would train and work with professional staff actually at Grand Valley that worked with these standardized patients. And so faculty would just observe these student-patient interactions in person and grade them. On average, students would do these 3 times a semester. So on a variety of different topics that you can see here, whether it be just patient education or some of the devices that pharmacists use in teaching patients or making recommendations. So students were fairly used to these types of assessments in person throughout the curriculum. And so what do we know? So we have, you know, over 100 students in our class, give or take a cohort to run through an assessment. And so as you can imagine, there's a lot of work that goes into that. No one knows that better than Callie, who does them across our curriculum, and she can highlight that a little bit more when she gets together. But to do an assessment for a cohort of students, it takes at least 20 faculty in all the various stations to get the students through in a timely manner. And that's still a pretty fast process with all of those faculty to be able to do that. We would use 8 to 16 standardized patients. And so again, not only is that labor intensive from identifying and training, but also there's a cost associated with having standardized patients come into the room. We would use 15 student volunteers to help logistics, shepherd groups of students from room to room, kind of be the eyes on them, watching them to make sure that they were doing what they were doing. So then we could use faculty to truly just assess the student performance as opposed to working with the students in the various areas. And these would take 7 to 8 hours every time we would do one of these assessments. we're fortunate in pharmacy that we're, you know, that lockstep type of situation, so we could extend days a little bit, but it's a lot of time and a lot of resource. And these are kind of concerns about each of these points that we've been thinking about for years, of sustainability, use of resources, some of those things about these in-person assessments that we've done. And it just seems like, at least through our curriculum, through our accreditation standards across our academy, the talk isn't less of these types of assessments, it's more. And how do we do them more formatively and give them feedback to then allow for summative assessment? And so a lot of questions about sustainability. And, you know, like sometimes I jump ahead and get excited about what I'm talking about. So here we could talk about, you know, the faculty did express concerns about that. But then, you know, they've started to kind of, what about virtual assessment? But there really was no sense of urgency to make that jump. So it's not that we had never really thought about doing these in a virtual format. I think a lot of us, you know, with what we've transitioned to in this last year, had kind of thought about doing some of that stuff, but then there's the need to rip off the Band-Aid and actually try it. And sometimes it just didn't seem like it was worth it. But here we are, and, you know, it kind of forced us into this direction. And so what was our solution? You know, the only solution we had really was to pivot to virtual. We really didn't have a choice to not do these assessments to meet the course outcomes, to meet the student learning. So we really opted to flip to this virtual assessment and see what happens. So when we did this list, yeah,
sorry,
go ahead,
Lisa.
Kelly.
Just to give perspective on some of this, the first one I had to flip from in-person to virtual, I think I had 6 days, because it was when spring break happened and the university didn't bring students back, as we know. And the OSCE was scheduled for the second day. We were supposed to be back in person. And so that also was a lot of stress and a lot of pressure, just to put a little bit of perspective around some of this.
You know, the other thing you were saying, Kelly, that I'm not sure that everyone knows is that our faculty are also really spread out. So I don't think I highlighted that. So the faculty that are doing this really aren't based in our Big Rapids or Grand Rapids facility entirely. So we do have faculty that had lots of travel from across the state that came to that. So that kind of added to those logistics as well. When we were doing this, we were not nearly as proficient with Zoom or had all of this figured out, but we did have history with Blackboard Collaborate. So we had done some virtual interprofessional education and different things using Blackboard Collaborate links and having multi-students doing it at the same time. So we felt a little more comfortable on that initial run using Blackboard Collaborate for the entire assessment. And so again, that was done completely online with faculty in their own areas individually and students wherever they happened to be. And so, you know, we did it, it happened. And those of us who were involved in it and did a lot of the planning were like, okay, so now what? So we had some questions that we felt like we needed to answer. How did students feel about it? How did faculty feel about it? And then how does that play into what we decide to do moving forward? Do we just keep going? I don't know that all of us thought we would be still doing this semester, but again, what did we learn and what are we gonna do now? And with that, I'm gonna hand it to Kelly.
Yeah, so as Lisa said, it was really an opportunity for us to take those lemons and turn them into lemonade, like all of us have had to do over the past year, and really try to figure out, what does this mean? As Lisa kind of alluded to, I was pretty resistant to doing virtual skills assessments. We have talked about them for a while, and I just kind of kept saying no, no, and dragging my feet and not wanting to do it. But we were at a point where that wasn't an option anymore. And so it was really the time to try to figure out, okay, we've done it now, so what do people really think about this? So next slide, Lisa. So what did we do to really assess those perceptions? We developed 2 different surveys. They were both 12-item surveys and pretty parallel instruments. So really using the same questions, just written appropriately for either the student or the faculty perspective. We used a 5-point Likert scale, so it was strongly agree to strongly disagree, and asked the students and faculty that were involved in all of these skills assessments to really rate their perceptions of how the activity went. And you'll see some of those questions on a couple of slides in the future. We distributed those surveys via Question Pro, and we sent them to all of our second and third year students, because those were the students that were involved in the virtual skills assessments that I was coordinating. And so those were the students that we used. We did incentivize the students to respond to the survey in order to help our response rate. And so I know in the third year students, I think it was linked to 5 points for one of the final weeks of class. And I think we gave the second year students a couple of extra credit points in order to fill out the survey. So we did incentivize them. All the faculty that had participated in virtual assessments had already participated in in-person assessments. And so all of them were invited to participate as well. We only left the survey open for 2 weeks because it was the end of spring semester. And we did send one reminder, and going based on some survey knowledge, the shorter time period actually can really help increase your response rate because people have less time and don't forget about it. They just do it right away. Next slide. So what are some things that we assessed? Depending on the year of the student, there were different activities that were being assessed for those students. All of them are really some sort of communication focused assessment. The majority of our hands-on assessments happen in the fall. So we do blood pressure, glucometers, inhalers. All of those happen with our P2 students or second year students in the fall semester. So since this happened in spring, we were really focused on a lot of communication skills. And so you can see they're listed there along with the times that they have. For the second year students, their assessments actually happened on 2 different days. So I think it was a Wednesday and then a Thursday. But then for the third year students, that happened all in one day. So that's one of those 8-hour assessments where we start at 8:30, 9 o'clock, and we go until we're done getting all the students through all the different stations. So just to give a little perspective. Go ahead, Lisa, next slide. To give you a little perspective also in comparing what the environments looked like between in-person and virtual, from a grading perspective, it was all the same. So we use ExamSoft, which I think I had on the other slide and didn't really mention, but we use a rubrics through that system. So that's an online system that we've been using for several years. So our faculty were pretty familiar with how to use rubrics. That didn't require any sort of training on my part because we had already been doing that for quite some time. I think one of the biggest differences is the sequestering. We always joke in our assessment committee that we're all control freaks, and this is one of the places where my control issues start to come out. So from an in-person and virtual standpoint, sequestering is different. When we did assessments in person, we were holding all the students in one room and then pulling them out when it was their time on the schedule to go. We would send them all the way through all of the skills stations. And then when they were done with their skills stations, they were instructed to leave the building. And so that was really obviously to help with the academic dishonesty, to make sure that we maintained case integrity the best that we could. It also allowed us to ensure students only had a certain amount of time to review all of the materials and all those different things. In the virtual environment, my control is gone. So I don't have the ability to really keep them in one room. I can't control how much time they're looking at cases. And so that's, I think, one of the biggest differences that we're seeing between in-person and virtual is really that controlled environment. I gave students instructions to only look at materials for a certain period of time. I'm sure there are those type A students that we have that probably followed my instructions to the T, and then I'm sure there are those students that didn't do that. And so that's a really hard thing to control and then create a level playing field for all of the students. Again, case information, students only had access to some information provided by preceptors in the in-person environment and different, they could have used whatever they wanted in the virtual environment. Next slide. I'll try to talk faster, sorry, Jenny. Our primary objectives, again, were really to look at student perceptions and faculty perceptions of how these assessments went. We also wanted to compare the second year students to the third year student perceptions because they did have different assessments and they were assessed on different communication techniques. And so we wanted to really compare those as well. And then data was used for our data analysis. Next slide. So we did have good participation from faculty and students. We had about a 95% response rate with faculty and about an 86% response rate for students. So overall, we had a good response rate. Next slide. And then if we look at the primary objective, Lisa, I think if you push, there should be some animation that comes up. So the first 3 statements, we did see differences between student and faculty. So the first statement was the virtual assessment effective at simulating a patient-provider or a provider-provider interaction? Students said 63% agreed with that statement. Faculty had an 88% agreement, but it was still statistically significant difference between the two groups. In terms of being allowed to demonstrate their communication skills, again, we saw pretty high levels of agreement, although faculty agreed with that statement a little bit more than students did. And then the third statement there is the virtual skills assessments allowed the evaluator to complete an appropriate assessment. Only about 60% of students agreed with that statement, and again, 88% of faculty did. But I think the next thing to really highlight is the very last line there. And again, Lisa, I think if you push the button, another box will pop up. So what did they prefer? So we know that they said that it was effective, or the majority of folks said that it was effective. But when we asked what they preferred, nobody preferred virtual. Only 28% of students preferred virtual, and only 33% of faculty, even though we had been hearing from faculty that they wanted to do some of this virtually. So that was an interesting finding that we had. Next slide. Secondary objectives, this is again where we compared the second year students to the third year students just to see if the types of communication that we assessed varied. And again, we really saw no difference. The P2s and P3s both had very similar rates of agreement with each of the statements. And again, very low rates of saying that they would prefer to do these assessments in a virtual environment. Next slide. We also looked at, in the third year cohort, we wanted to compare scores of students from the year prior where we did it all in person to the current year where we did it all virtually. And for two of the skills, we saw no difference. We did see a difference with the healthcare provider recommendation. Because of time, I won't go too deep into that, but I think a lot of the structure is where some of that variance probably comes in, meaning that students could have taken more time to review some of the case materials. There's also some concern that maybe faculty felt bad for the students and didn't want to harm their grades in any way. And so maybe they graded them higher than they would have if we were in an in-person environment. And so there's a lot of different theories in terms of why that difference was potentially seen. Next slide. From a connection standpoint, we wanted to look and see if their connection, whether they connected with video and audio or just audio, impacted how they responded to the survey. And really, we didn't find any difference in terms of their connectivity and how that impacted their perceptions, which I think ultimately is a good thing. We did have some qualitative responses. Students and faculty that preferred in-person stated that was because that's how most interactions are going to be in the future. So that's how they should be taught and that's how they should be assessed. So that was a very common theme. And then those that preferred the virtual environment tended to comment more on the flexibility that it offered, that they didn't have to commute to the site, that it saved them time. And then another student I thought made a really important comment, which is that it really exposes them to the importance of telehealth, which I think we all know in the healthcare world that that's a lot of what's happening right now. And so I thought that was an important comment. Next slide. So what do we know now? Where are we now that we've honestly been doing this for a year? Go ahead to the next slide. So we did learn some lessons. So despite all of the hesitations that I've had over the years about doing this, we now know that it does work. We've been doing this now for a year in Zoom. And again, for the most part, everything is working very, very well from a virtual, at least from my perspective. And I think most faculty have been giving me that positive feedback as well. We all probably also know that as we use technology more, our comfortability increases. And so some of the qualitative comments we also saw from students was that they had a lot of anxiety just based on the technology. They didn't know if it was going to work. They were nervous about that on top of the assessment. And so I think that that's an important thing to remember, is that the more we use this technology, the easier that piece becomes. And then we can really focus on the skill itself. From a logistics standpoint, we did learn a few things there as well. When we first did this, we did not have any waiting rooms enabled. And so that caused a couple of problems where students would enter the virtual environment and hear feedback another student was getting. As you can imagine, that caused some concerns of the students. And so that is now something that we do all the time. We always have waiting rooms enabled so that students can get in, get set up, make sure their stuff is working, but not hear feedback. So it really allows students to have their privacy from that perspective. We also know that breakout rooms may also be an option for some of these assessments. I don't personally use breakout rooms. Another faculty within our college does. What I tend to do from a Zoom perspective is every faculty has their own unique Zoom link, and I post all those for students along with a schedule. They can look and see what link they get. But breakout rooms also do work, and so that is an option as well. Next slide. So what are some best practices? Some things that we would really recommend now that we've done this is to really frame this better for the students, meaning giving them practice up front, giving them regular practice. Now that we have class in Zoom, they're very familiar with Zoom and they're really familiar with the technology. Same goes for the faculty. Everybody's gotten really used to this virtual environment, but that's important. If you don't do the virtual environment, you need to make sure you do that before you do this type of an assessment. Again, intentionally framing how it applies to their future practice. One thing that I mentioned, I think, was that we got comments that this isn't how future practice is going to look like. Now that we've been in a pandemic for a year from a healthcare perspective, that's what a lot of healthcare looks like right now. And there's a chance that that's going to stay that way. And so really framing for the students that, you know, yes, you're right, you are going to do a lot of patient care and provider interactions in person, but a lot of those are also going to happen virtually or over the phone. And so getting that practice really is applicable and helpful to you in your future. One thing that I also do, and I would recommend, I use Teams and SharePoint to distribute files. When I did everything in person, I made copies. I had folders with people's names on it, sent that all out. Now I do pre-briefing a week in advance. I send all the files and they have access to all of that. So some of that is just that logistical planning that has to go into place. Next slide. What are some things that we're still working on? Academic dishonesty continues to be one of the biggest questions that we have. I know it's a big question for everybody when it comes to this virtual environment. We also have questions related to those hands-on skills. So glucometer, inhaler education, blood pressure assessments. We did do some glucometer and inhaler education this past fall, but it wasn't a part of the survey when we did this. So we're still working on some of that. What is the proper balance? So we know that virtual works, but that doesn't mean that we should do everything virtually. So trying to figure out what that proper balance is so that we do keep giving students in-person interactions, but also doing this virtual environment that, again, we know is going to also relate to telehealth, but also can help from some of those logistical workload standpoints. Another thing that we've encountered a lot this academic year is students attending or being at work and attending these virtual assessments while they're at work. And so that is a question that we have related to professionalism. I had my first student that couldn't complete the assessment because of work this week, or last week actually. And so I think a lot of those things come into mind. Last slide, I think. So conclusions, faculty and students perceive that it can be used, but they still don't prefer it. But we also know that these assessments are probably here to stay, and we just have to figure out how best to do all of that. And with that, I'm going to end in case there are any questions.
Thank you, Callie. And Lisa, and we definitely have at least a few minutes for questions. So if there is a question or two, feel free to unmute or enter it into the chat.
I have a question if I could. I was just curious, did faculty notice any differences in students, you know, mannerisms, body language, all of that? I mean, years ago, I participated in some of these and you could just tell when a student was really nervous and they're coming up to your station. I wonder, does that come through in the virtual format, or are there different things that you're seeing between, you know, in addition to just the skills, but it's all that other stuff, you know, that you observe?
I do think that there were. I know one thing that sticks in my mind is I had one faculty tell me that a student was massaging their camera during the assessment. So just some of those awkward things that I think that you don't realize if you don't do this all the time. And I think that that was another comment that was on the qualitative analysis, is that it is a little bit harder to assess nonverbal communication skills.
I would just add to that, you know, as an evaluator of this, you still get a decent amount of that, you know, the nervousness and communication. So I don't think it's impossible to get that, but it is definitely a little bit different. And like Callie said, I think that's a concern of the faculty.
Are there any other questions? One thing I would say, so there was a second-year resident at Spectrum Health that actually just picked our article, because this was just published online this week, that picked our article as a Journal Club article. So we actually met with that individual prior to this session today, which spurred the idea of actually repeating these perception surveys this year. Because now that we've done this for a year, we've been in Zoom for a year, our anxiety related to technology, I think, has significantly decreased. And so we're wondering if those perceptions have now changed since we've been doing things a lot differently. And so I'm trying to pull our group back together, and I think I've got everybody on board to really repeat these perception surveys and see if there's any difference now.
The other thing I would throw out there, to anybody who's interested or looking like that, we have a big group of people that are fairly familiar with doing these type of things, that if you have any questions, feel free to reach out to us. And, a lot of the discussions as well still goes back to what are we trying to assess, and can we do it in this format? Because not everything does work in that. And those are the conversations we're going to have, but we'd be happy to go into more detail of some of the logistics, because I feel like that's the very intimidating hurdle to get started. So we appreciate everybody's time today. I know there's a lot going on, so.
Well, thank you both again for a great presentation, and we'll give everyone some transition time now. So have a great rest of your day, and grab your lunch, because the next sessions are lunch and learn.
Thank you, everybody.
Okay, I'm going to go ahead and stop recording.